here in Westminster today with Gillian Merron, Labour's Public Health Minister. Gillian, thank you very much for joining us and answering some questions on public health.
Pleasure.
Now, of course, all the parties are making health a big issue in this forthcoming election. In such difficult financial times, though, how would you ensure that the health prevention agenda gets the funding that it needs?
Well, the first point is ill health prevention makes sense. And we recently set out our strategy for the next few years called From Good to Great. So that's taking the NHS from good to great. And in there, prevention is absolutely key. Because unless we help people to have a better quality of life, we're never going to take the pressure off the National Health Service. So it makes financial sense, but actually it's the right thing to do as well. And increasingly, if you look at the way we've gone as a government over the last 13 years, we've really bought into the idea that it's not just a priority, it's a good thing to do, but it's also a very wise thing to do. And of course, you know, whilst delivery of services is decided locally, because as is right, you should adapt them to what's needed with your population. Nevertheless, there are expectations set by government that local health services have to meet. Not just on their own, but of course you've got to work with local authorities and other organisations as well to deliver better health and better and longer lives.
Now, one particular issue that's particularly significant in the northwest as elsewhere is, of course, childhood obesity. If you were successful in the forthcoming general election, what in particular would you do to tackle that issue?
Well, the good news is that we've seen some signs of improvement. There are signs that childhood obesity is levelling off, and I also know what a huge challenge it is. But that's why we've had for the last, it's only a year in fact, but Change for Life. Change for Life has some very good information and support for people, and it's about eat well, move more, live longer. And the fantastic thing is we've got 1 million mums saying, yep, I've changed at least one thing. I'm putting healthier food on the table, I'm getting my family to move more. So we're seeing changes in how people are behaving. We know that for a fact. So we're influencing and supporting and guiding people. But I do think that you've also got to do what's important to help people. So we see more and more, we've worked very closely to get this. Calorie labelling, for example, in fast food and other restaurants, so people can make the right decisions. Never forget, people often don't have the information at hand. And we're also going to see the introduction of a better labelling system on the front of packets, and we also work closely with industry to get them to do things like cutting down sugar, cutting down fat in their products. So in all these ways, it's about helping people to make the right choices. But we were just talking about dancing, as I did. We had a free dance for a dance weekend, for example, to get people of all ages thinking about doing something a bit more active. So all the time we're making new opportunities. Our free swimming for the under-16s, something we're very passionate about. It's making a change to people. So childhood obesity is a big challenge, and we know it's a challenge to meet, but we are seeing some signs of improvement now.
Moving now onto the issue of alcohol, how would you tackle the rising tide of alcohol harm? And in particular, would you support the idea of a minimum price per unit for alcohol?
Well, again, we know it's a big challenge for us, and people have been, this has been a big challenge for many decades, not just in the last 13 years. In fact, we're seeing consumption again reducing, but we are seeing difficulties with it. So my main point about this is no one thing talks to anybody. So we have to do several things. We have to give the information. So we've just launched a consultation on better labelling so that you and I know how many units are in what we're drinking. Secondly, we've just brought in changes which will take place from a couple of weeks' time, banning the worst excesses. So, all you can drink for 10 quid, women drink for free. Alongside that, bars, pubs, clubs have to provide free tap water, and they also have to provide drink in smaller measures, so more choice. So an environment where you can make a healthier choice. And of course treatment for those who need it. In my own area of Lincoln, my local alcohol and drug service tell me that their service is transformed. Price is an issue, wouldn't doubt it for a minute. We haven't ruled anything out, but what we want to do is to take the right steps on price and anything else that will have the right effect on the right people. In other words, no point punishing responsible drinkers, but every point in doing things that will tackle, as you rightly say, the challenge of alcohol consumption.
Now, on the issue of tobacco, we know there's been a number of major changes in recent years. How would you prevent the tobacco industry from targeting children and young people in particular?
Well, we've done a lot on this, and I took through the provisions in the health bill, which are about banning the sale of tobacco from vending machines, which is a big source of children's tobacco because it's not supervised. We're also going to see the ending of tobacco displays, because we know that if you make tobacco more attractive, children in particular are attracted to it. We've already raised the age at which it is legal to buy cigarettes, and the reason for all these things are about protecting children. We know that many smokers tell us that they started smoking when they were children, so we have to stop the new recruits to the industry which are there to replace those who are dying out. But you know, we've massive reduction in smoking rates, and we're going to carry on. And our NHS Stop Smoking services, I think, are really fantastic. They've been going 10 years. I'm very proud of them and the work that people do for us, and we save 70,000 lives. So still a lot of people dying from the preventable damage that tobacco does, or having ill health, and children are a huge part of that. So, you know, we're constantly forcing that one ahead.
And finally, if you could propose one piece of legislation, if you like, a fantasy piece of legislation, or one major measure that you think would make a real difference to public health, what would that be?
Well, I'm hoping it won't be a fantasy, but I'm hoping it will happen, and it's the Sunbeds Bill, and it's getting its second reading in the Lords tomorrow. This government is absolutely 110% behind it. It's again about protecting children, because it's prohibiting children from using sunbeds if they're under 18, because we know the damage that it does, and the fact that it means more are suffering from skin cancer. And in the Northwest, the levels of use, and Nicola Roberts has done a great job profiling that and supporting the campaign, and interviewed me herself for BBC Three. So you're not Nicola, but you're still going to do a good job. But you know, I am not just keeping my fingers crossed. I'm doing everything I can to see that legislation come into being before we're into a general election. So it's pretty tough, but I'm hoping it will be real, not a fantasy, very soon, so we can protect children from burning and skin cancer. Would be a great achievement.
Gillian Merron, thank you very much indeed.
Thank you.